Hi folks, I'm Duncan Gill, child and adolescent psychiatrist.
And I'm Victoria Lee, licensed clinical mental health counselor, and welcome to Is There a Med for That? The podcast about teen mental health and behavioral problems and what to do about them.
Victoria and I have been working for years together with kids. Sometimes we use therapy, sometimes medication, sometimes we give some guidance to parents.
And sometimes kids just need to be left alone.
We don't have all the answers, but we probably have some of them. We'll do our best to share what we've learned over the years working with struggling kids and their families.
We hope you enjoy the show, and we can be helpful to those who have taken on the hardest job in the world, being a parent.
Hey everybody, how you doing? Duncan Gill and Victoria Lee here, and another episode of Is There a Med for That?
Good afternoon, everyone. Happy to be here today with Duncan. It's been a little bit since we've recorded, so getting back in the swing of it.
It'll probably be a little rusty today.
I like that word, rusty or rustic. Duncan likes to laugh when we do the podcasting.
I think of the first one.
We had a lot of fun, though.
That's
That was
true.
a good bonding experience
Yeah, it was.
to mess up a lot together. We got to create the bloopers.
Right. I think we've probably got 2 or 3 so far. Anyways, here's what we're going to talk about today. I thought maybe we'd talk about levels of care.
Very important.
So parents who come in with kids often don't know the different levels of care that there are in terms of what treatment options are available. And even if you know what the options are, unfortunately, they're not always available everywhere. And the waiting list, particularly where we are in New Hampshire right now, it's pretty bad.
And we're talking about levels of care for mental health.
Correct.
Or
And
behavioral
substance
health.
abuse, yeah, all those things.
Great.
But I thought maybe we'd do briefly, I have a list here, everything from outpatient therapy to outpatient medication management to group therapy, intensive outpatient programs, inpatient hospital programs, our personal favorite, I'd say, and inpatient units and residential levels of care. Did I miss any, Vicki?
I would add maybe peer recovery support groups, like that's, maybe prior to.
That's a good idea, like
Yeah.
AA, that kind of thing?
AA support groups, but then peer level, even programs like drop-in centers, recovery centers that are only peer run. So there's
Great.
no clinical team, but there is support for substance abuse or mental health issues with other people who have been in recovery from that issue.
Great. Let's put that between outpatient med management and group therapy. How's that sound?
Perfect.
Great.
I'll take your lead.
Okay.
Follow the doctor.
All right. Start with outpatient therapy. This is usually where, what parents think about when they're looking at treatment for their kids and adults as well. Outpatient therapy usually looks like going into an office, maybe once a week, maybe twice a week, maybe a little less frequently. I'd say most often it's once a week. And meeting with a therapist and talking about things, talk therapy, and then hopefully getting better over time. But it's really a good place to begin, and usually can't go wrong with it, even if, it's worth a try.
Yeah. Yep. I was going to make a bad joke about bad therapists, but I don't want to offend anyone, so.
Not yet.
Not yet.
Too early.
They warm up a little bit here.
But yeah, so there's a number of different types of therapy. And I should add right now, finding therapists right now, at least in New Hampshire, is difficult as well. So we're talking about weeks.
It really depends. Sometimes you can get lucky and get in, but I think, definitely weeks to months for some people, unfortunately. And there's all different types of therapists on the outpatient level of care. So it depends on what your needs are, what diagnosis your kid has, or you, if you're the one looking for therapy. So if you're, there's trauma-based therapists, there's WED therapists such as myself. You have tons of different types, and they all generally do a lot of talk therapy, but there's a different approach to it.
I was thinking about it a little bit, and I sort of have of the school of thought that good therapy is good therapy, and that some of the differences between the different modalities of therapy are more superficial in some ways, and there's some real fundamental ingredients that if you can get, I would say some people respond to different types better, but I think it's seductive to think that if you have a certain problem, you need a certain type of therapy. And I think particularly nowadays, they really try to split types of therapy based on diagnosis. And I think that sometimes is a mistake.
Yeah, I think you're right to put first things first in terms of looking for a therapist. And a lot of it has to do with the quality of the therapist themselves and their ability to have a healthy relationship and who they are as a person who you're working with.
Exactly. The single most important thing is, if we're talking about your child, is the ability to connect to your child.
Yep.
And I'd like to say initially it doesn't matter whether or not they like you, but initially it really does. And able to gain the respect, which is more important, a kid really has to like a therapist to start with.
Yeah, therapeutic rapport, as they call it in the field, right? To be able to build a relationship, therapeutic working relationship with the human that you're having the hour session with every week. Yeah, you have to definitely like your therapist.
You got to like your therapist. At least
You might not
in the
like
beginning.
moments. You might not like
No.
moments with them, just like with like a healthy parent, right? You're going to hear
Yeah.
things you don't want to hear, things that are maybe uncomfortable or painful to hear and process, or feel abandoned or upset at times. But that, like all relationships, includes it all.
Yeah. Angry. You actually, some people might hate their therapist, but if it's a respect thing, usually it's the overall relationship that's more important. It's the moments you may not like. As a matter of fact, that's an important ingredient of therapy as well.
Right. If you're comfortable all the time in therapy, you're probably not doing a whole ton of work.
I had a great saying that was, therapy is two people talking in a room, one person's more anxious than the other.
Yeah. True. And it might go back and forth depending on the moment.
Another fundamental thing that's important for therapists is the same as being a good parent. A good therapist works on promoting independence.
Yep.
And so ultimately, at least theoretically, the job of a therapist is not to be needed anymore,
To become obsolete.
to become obsolete. So even if that doesn't happen, it's important that the therapist that you work with is really trying to promote your development and independence.
Right.
I say that because sometimes people get caught in therapeutic relationships in which the therapist may actually be trying to promote dependence and continue the therapeutic relationship in a bit of a pathological way.
Yeah, absolutely. Yeah, so being mindful that you're there hopefully as a temporary thing, and there's more extreme cases where maybe it's going to be longer care, but having a therapist whose goal is to help you function well and to be able to do that with your support that you have outside of the therapeutic session. How do you integrate healthy relationships into your life, or whatever else you need to add to your life to create the balance?
Exactly. So anyways, that's individual therapy. Anything more you wanted to say about that, Victoria?
There's a lot of telehealth right now available.
Thank you.
In my private practice, I do telehealth, which works out right now just for the clients I have. For my life with, as a young mom, not a young mom, but a mom with young kids.
You're young.
Middle-aged mom with young kids. It, allows me to see more clients per my schedule per week without having to commute. So there's that option. And also in a state like New Hampshire, I think the telehealth is nice because in rural areas, you can now pick from a larger pool of people to work with. So you can do a little bit more shopping, or if there's just not anyone in your area. Also, too, I work with people who have maybe multiple DUIs and have lost their license. So the telehealth option is nice. But then there's, obviously in person, which has benefits too. But I think you can still facilitate the relationship over the telehealth. A lot of people at first don't like the idea. And to be honest with you, if you had told me I was going to be doing telehealth 3 years ago, I would have said, no way. I'm not really a big tech person. I don't really like a lot of screens. But I think COVID opened up a whole nother avenue, or, maybe pushed along something that was coming anyway. And it does, I think, give more people access to clients and more clinicians access to clients, or you know what I mean? Vice versa, back and forth.
More options, more better.
Yes.
So that's individual therapy. I was going to talk briefly about medication management.
Yeah, because I'm going the same direction because I'm thinking you can also do like outpatient individual. We can do like outpatient family therapy too.
Good point.
So you could have like a therapist who works with you
Right.
and your kids and husband or wife or whoever you have in your life. And you can also do marital counseling on that level where you meet once a week and then maybe eventually bi-weekly. And eventually you just need tune-ups or you don't need them at all.
Yeah, for the kids we work with, family therapy in particular can be very useful because, they talk about, the system is dysfunctional, sometimes not just the kid.
Yeah.
But,
There's no identified patient, so to speak.
right.
Often I think parents want to come in and have it just be the child just needs to change. The problem is, fix the kiddo and everything will be fine, when usually it's a larger picture that it can at least be tuned up, so to speak, to all improve.
Right. So as far as outpatient med management goes, that's usually less frequent. I'd say probably the average is once every 3 or 4 weeks to see a med provider. Those are usually shorter visits, 30 minutes.
If you're lucky.
If you're lucky.
Or maybe unlucky if you have to work with Duncan.
It depends. But yeah, I should mention in terms of medication providers, there are really a couple types. There's psychiatrists,
The weirdest of them all.
the strangest of them all by far. So if you can avoid and get a nurse practitioner, please do. Psychiatrists are medical docs. They've gone to med school, and then they do a residency afterwards, focusing in psychiatry and sometimes a fellowship for child psychiatry. You have nurse practitioners as well who do nursing school, and then I think it's a year or two of a more specific training in medication management. There are also PAs, physician assistants. We don't have so much of that in New Hampshire, but that's another specialty that
Where are they big?
I think Massachusetts, I think Connecticut. I was just talking with our friend Susan today, who said that PAs doing psych here in New Hampshire actually need 2 medical docs supervising.
Wow.
Which doesn't make any sense in the world to me, but that's
Do you know
she
what
says.
their education is? Like, what's the difference between an APRN, like a nurse practitioner, or in a PA?
That is a great question. I don't know. We'll have to
look into it.
We'll have to look into it. But most important thing in a med provider is somebody who listens, somebody who has an open mind, and I'd say the relationship's a little less important. I mean, obviously you want as good a relationship as possible, but a med provider, even a med provider who can be a competent technician, can be effective, particularly if you've got a therapist who you can connect with. It's better to be able to do both and to have somebody you really like and respect. And some psychiatrists do therapy as well as med stuff, but it's probably the most important thing is.
Someone recently told me a little saying, doctors treat, therapists care.
What's that supposed to mean?
More like, like we often joke between us, right? That you
Yeah.
have it easy. Like you bring the same problem to me or to Dunc, same issue. And within 5 minutes, you can talk to a kid and have the kid out the door. And with me, it's like an hour-long
true.
situation.
That's true.
But I think they're both important.
They are, but that's why
different.
I do what I do.
Keep it simple.
No, that's absolutely true. And if you think about other medical professions like ER docs, surgeons, more technicians, it's more, what was the term you used? You said treat. Right, treat.
Right, and I don't mean therapists or like nurses care, like you don't care,
Right.
but provide care,
Right.
like the ongoing caregiving.
Right, agreed.
Yep.
So that's medication providers. I want to make sure we have a chance to go through some of the others. We do there are groups,
Outpatient group therapy.
outpatient groups, maybe once a week usually.
Yeah, and usually groups nowadays seem to be more temporary, like a 10-week brief group.
Right.
Where you have a set, like a cohort that starts together and you go for 10 weeks. But no, at least in New Hampshire, I don't know a lot of groups that are just ongoing.
I bet insurance has a lot to do with that.
Yep, true.
They're like, modular treatment.
Yep. The groups can be focused on various specific subjects, whether it's a support group. It can be a support group sort of thing, even like with a clinician facilitating the group, or it can be more of a group where there's like a CBT group where you're learning skills. There's process groups where the group is an entity unto itself, and you're looking at how clients relate to one another, and you're learning about self through how you relate to the other people in the group, which is a lot of what we actually do at Direction.
That's right.
Grist for the mill is when it gets really real.
Yeah.
It's good.
So one of the principles in group therapy, one of the differences, and this is part of the reason I think it's important to have a cohort, the same folks showing up every day, is called universality, which means kids or whoever patients are coming in and getting a sense that they're not alone and that they other folks share the same problems or similar problems in different packages. But that's very powerful.
Definitely. And that alone, if for certain kids, if they can get that out of a group, that alone can be really healing and help them right size what's going on in their life or give them perspective. Yeah. And then groups start to have their own personality, their own life. And so if you try one group or you don't like it, you can always try different groups too. If you tried it and didn't work, doesn't mean every group is going to be like that for you. A lot of people are afraid of groups, or intimidated by the group therapy idea, which I understand, to put yourself out there in front of a group. But I do think that if you can take that risk, there's often a level of healing that can occur when you do it in community.
It's true, and part of the reason, just like with the kids we work with, part of the reason that you don't want to do it is probably the reason that you should do it.
Yeah.
Right? It's
right.
Facing anxiety. It's facing yourself.
Yep.
But absolutely worth the risk. There's some sort of hybrid programs. I think DBT often has both group sections and individual therapy sections. So these are various sort of specialties of group and individual therapy. And again, I view it more as good groups are good groups, but probably for some types work better than others.
Yeah, and like I said, groups can teach you skills, but then if you're thinking of it like a clinical type of group, often for issues that are social-based issues or issues with how you relate to the world, that can be a great setting to practice those things in, whereas individual therapy is often good for more internal depth work, if you will, or just more specific stuff to yourself. So they can be used in conjunction very well.
Right.
Get to different issues.
So group therapy, sort of the next level up. Oh, did you want to talk about peer support groups?
Yeah, so peers are people who have been through the recovery process, whether it's they're in recovery from substance use disorders or they are in recovery from a mental health issue. But there are peers who've gone through some sort of program or treatment successfully and then continue to work in the field, offering support on and sharing their experience of what treatment was like and bringing a lot of compassion and empathy to care. And so they're a great I always call it like the ground level. It's almost like foot soldiers, right? Like they're really in the thick of it with people often and helping them to connect and see options. And they're usually very trained in knowing suggestions as where to go if you're dealing with certain issues, like to what level of care you might need or what resources in the community are out there if you're struggling with certain things. They aren't clinical, but they're very supportive in nature. They can be drop-in centers. They can be like coaching sessions you have with someone. But the drop-in centers are relatively new in New Hampshire. In the recovery field, like Revive in the area or ARC, New Hampshire, they're drop-in centers where people can come and get resources from peers in the community who have gone through the process, which is really fun. In Vermont, I went to college in Vermont, my undergrad and my master's degree, but they have a lot of the kind of clubhouse sort of recovery centers where you can go and play pool and just be around other people looking to have more wellness in their life.
This would be where something like AA would fit in, right?
AA is more, I would say, a support group, but it's not. Yeah, it's interesting because often at like a drop-in center where there's peer workers, like AA doesn't have any paid workers. It's all people just, who go there to better their own life.
Right.
Whereas the peer recovery model or peer support model usually has paid work. It's a paid position who are like responsible for running that organization or offering the coaching sessions. So it's a little bit, it's different. But yeah, AA groups and, or smart recovery, refuge recovery, NAMI groups, there's a lot of different types of support groups out there that are volunteer based, where everyone's going through it together. Whereas there is still some power differential in the peer based support. There, in theory, and I don't mean that in a negative way when I say in theory, but there's a little like more advanced than someone coming in new to recovery. And in AA you'll have that too, but that everyone sees that more as like they're going there for treatment, whereas peer people aren't necessarily using that as their treatment.
I see.
It's part of a healthy life for them, but not for treatment.
Right.
If that makes sense.
It does.
And it's newer model, and I know Biden recently, and I have, politics aside, they mentioned trying to increase the peer level of care more across the nation, because there is a crisis in having enough mental health providers, and peer support workers can really add a much needed level of support to the medical care.
Absolutely.
That's very much needed.
Yep.
Yeah.
More treatment, more better.
Yeah.
More options, more better. Next level.
A new Duncan slogan.
See how long it lasts.
Joe would cross that one off right away.
He wouldn't like it.
No. Sometimes more is not better. Sometimes they just need to be left alone.
Less options, but better options.
Perfect.
Next, intensive outpatient programs, partial hospital programs. That's what we run.
Intermediate level of care.
Intermediate. It's usually a package of services. It's usually an everyday thing for a few hours a day. And the major difference between partial hospital program and intensive outpatient program is an amount of time. It's sort of a rule of thumb. Probably partial is usually 6 hours a day, and intensive outpatient programs usually 3. Intensive outpatient programs also maybe every other day or a couple times a week, where partial programs are more intensive.
Yeah, I think in a lot of that definition is determined by insurance companies.
Right.
Like what their, I don't know what you call it, contracts or stipulations are to be able to use that term with them, what they'll pay for. Typically for adolescents, it's a minimum of 6 hours a week, and then adults are typically 9 hours a week
For
the
an IOP. Yep.
Yeah. And interestingly, yesterday someone brought up a parent was concerned when they heard the PHP, partial hospitalization program, because it says hospitalization. But there's no level of staying overnight in a PHP.
No, although partial hospital programs usually occur in a hospital setting, or they're more likely to be in a hospital setting. But no, it's not overnight. It's a few hours. And in the partial hospital programs, PHPs and IOPs, it's a package of services. So it's usually, particularly in PHPs, it's a doc or a nurse practitioner doing meds. It's group therapy. It's sometimes individual therapy, family work, and that's what we do at Direction.
Yeah. We like it.
We do. So we recommend this level of care.
For everyone.
For everyone.
It isn't for everyone, but I think it is a great option that we need more of in many areas, just because sometimes once a week really isn't enough for kiddos to get traction. You can, like it might be great that you got into one, but then it just sometimes is not enough. But maybe you don't need to go inpatient or to the ED to get assessed. And so it can be a great way to, like they call it, intensive care, but doesn't have to be actually overnights or, locked up, as some people sometimes fear with the residential or hospitalized programs.
Speaking of which, inpatient programs, next level of care.
A lot of parents find this scary.
Absolutely.
In kids.
And kids. It's actually going into a hospital, a psychiatric hospital, psychiatric unit, and being there overnight, and usually there for a few days, average probably 5 or 6 days, and Sometimes it's much longer, a few weeks, a month, even at more chronic hospitals, adult hospital like New Hampshire Hospital, people have been there for 2 years inpatient. So, but usually it's a
Extreme
few
mental
days.
health issue.
Yeah, and no place to go afterwards. But hospital level care is really reserved for people who are a danger to themselves or others in a really imminent way. So suicidal actively, meaning thoughts of suicide right now, intent to commit suicide, real aggressive, somebody who just can't be home. And it's a very scary thought for parents, for kids to go to an inpatient unit. By the way, there's only one currently for kids in New Hampshire, Hampstead Hospital. There's far too few of these as well because they are necessary sometimes. Sometimes a kid is just not safe at home.
What would you say to a parent who's afraid if we were to recommend inpatient care?
Yeah, if it's to the level we recommend it, inpatient level care, a lot of parents will say, well, it's not going to change anything. There's a few fears about it. And that may be the case. The primary function of an inpatient program is to keep somebody alive and safe. And that's not a risk you want to take particularly if professionals are saying, your child's at, life and death risk.
Right.
Inpatient units can be useful in a few ways. Actually, sometimes meds, real intensive medication management will make a big difference. They can do it much quicker in inpatient units. Sometimes just the break from real life and life stressors and family and school and relationships makes a huge difference. Sometimes just the experience of knowing that there's a safety net and some place to go if everything falls apart is huge as well. Sometimes it's important kids get the message that what they say is taken seriously. So if you have children who are, quote unquote, upping the ante and talking increasingly about suicide and doing increasingly provocative things, even if they're not really, that's not really their intent, they're more looking for a reaction from folks, that experience of that level of care can be huge for them, and realize that folks are going to take it seriously and, gee, I better be more careful about the way I communicate.
In terms of an adolescent versus an adult unit, very different?
In terms of what you see there, they're very similarly structured, with a psychiatrist or nurse practitioner doing meds, usually daily checks, group therapy. It's primarily individual therapy, so it's meals, sleep, checks. But the difference between an adult unit and a kid unit is pretty stark, just based on the types of problems treated. With kids, it's usually much more mild depression or moodiness or developmental issues, suicidality, cutting, that kind of thing, whereas with adults, you start to see major mental illness, schizophrenia, bipolar. So it looks a lot different when you walk on the units.
More intimidating for the adult unit, probably.
Yeah.
Yep. Good. And then do we have another level of care to get to?
Residential. And this is a longer-term inpatient, not always locked. Some psych units are locked, some not. But for kids, there are a whole bunch of types. There's mental health ones. There are ones for kids who have real family problems. There's residential programs for substance abuse. Vicki has a lot of experience. She worked at Nashua Children's Home, which was is one of the local residential centers.
Yep. Yeah, the residential level of care is more long-term than inpatient, so it's different than inpatient. I think sometimes people get them confused. So you're living at a facility. In, like, say, one like Nashua Children's Home is a place where kids go when they need to be out of their home or wherever they're living because of what's going on there, or if their parents need them out because of their behaviors. There's lots of reasons why you can end up there. And that stay tends to be longer than at like a Newport Academy type of residential facility where you go to treat anxiety or depression. And so there's lots of different types. but they can be a good option for when you've tried PHP, IOP, individual therapy, and the issues aren't getting straightened out with that level of care. And like you said, with the inpatient, residential also provides removal from some of the daily stress to focus on certain things.
And removal from, for substance abuse, removal from the ability to use, which makes a huge difference for some
Access.
people. Residentials can be weeks, they can be months, they can be years, particularly if you don't have a family unit to return to, or it's so dysfunctional, it's unsafe. So,
Well, thank you, Duncan. I think it's a great start to talking about different levels of care, and maybe at some point we can talk more about residential and inpatient, but maybe that's enough for today.
sounds good. Hope you folks have found this helpful.
All right, take care.
Bye-bye.